Pelvic health issues such as pain, fibroids, incontinence, endometriosis, and abnormal bleeding can have a major impact on a woman's lifestyle. These problems can range from being inconvenient and embarrassing to debilitating and painful. The good news is that expert help is available through the Norwalk Hospital Pelvic Health Center. You'll hear about this new center on this week's Helath Talk. We're up next. Hi, I'm Dr. Mazur. I'm back with my guest, Adina Leifer. She's a pelvic physical therapist at Norwalk Hospital, pelvic physical therapy.
Yes.
So we were talking about some of the people, some of the conditions that you treat,
right.
the muscles of the pelvis. Maybe you could tell us a little bit about what pelvic physical therapy is like, because I think of physical therapy, in the traditional sense of lifting weights or,
right.
or moving range of motion of joints, but we're really talking about a different area of the body. So you take me through
right.
a session, if you would.
It really is very similar to regular physical therapy because we are working with the muscles. And basically a normal session could be, I may do a little hands-on treatment where I would find the muscles that are weak or tight. So that would be internal, where I would go internal and kind of feel for the muscles and muscle test to make sure that you're using the right muscles. I always tell patients, try to hold in your pee, and that's kind of how we test to see if the muscle's strong enough.
So you can actually test using these sensors that are inserted?
Yeah, so one part is using the actual biofeedback, and the other part is me doing that manually.
So you actually could feel whether the muscle's contracting strongly
contracting
or not.
properly or not properly. So that's one part of it, and the other part is really strengthening, exercising, and really teaching proper exercises. Everyone out there kind of knows of Kegels, as you had mentioned, and nobody knows how to really do them correctly. So we really treat and teach people how to do those strengthening exercises so that you're really targeting the right muscle.
I was going to say, it seems to me that it's not intuitive how to contract the right muscles of the pelvis. I mean, contracting the biceps is pretty straightforward.
Right. But that's easy because you can actually see your bicep.
Exactly.
But these are muscles that are internal that you can't see, so you don't know if you're really using the right ones.
So you can actually train someone to contract the correct muscles. And is it the same sort of principle as you would use for the biceps, that you use it and relax and use it and relax it as a way of making it stronger?
Yeah. So if you kind of shorten a muscle and really use that muscle like a regular contraction, like a bicep curl, the same thing would be pulling up with a Kegel and try to holding in your pee. The other option is kind of stretching that area, and either I could do that manually for the patient, kind of going in and massaging out those spasms.
When would you use stretching exercises for the muscle?
So if someone was very tight, there's a condition called vaginismus, which has a lot of press about it also, but a lot of times muscles of the pelvic region are very, very tight, where women can't even insert anything into their vaginal area. So vaginismus we would kind of stretch out those areas and really gently massage to kind of open that area up so that it can be more functional.
Mm-hmm. And how about other muscles? We were talking about my friend with the pelvic pain.
Yes, so everything's kind of connected. So your abdomen and your low back and your hip area, we really want to stretch and strengthen that area also. So the main part of physical therapy is really exercise and really retraining your body and your muscles to work the way that they should and work properly.
Are there ways other than massage to loosen up tight pelvic muscles? Are there
stretching?
Stretching?
Yes, stretching is the key to everything. I always say, whether it be your arms, neck, head, low back. So really stretching out the muscles, and that could be hamstrings, so the muscles of your back leg, and really stretching all of that. And that's part of the exercises. Sorry.
So there are actually ways you move your legs and your pelvis to stretch it out. And when you evaluate someone, with the pelvic pain syndrome. Are you able to identify which muscle is the muscle that's causing them the pain?
Yes, usually I can. Sometimes the way someone's even walking, I could figure out what's kind of going on. But with the pelvic muscles that we can't see, when I kind of feel it manually, I can tell which muscles.
You actually feel that it's tight?
Feel that, yes. You could feel the spasms in there. You could feel if they're weak. You can feel if there's tightness there. And then you could massage it out or even like stretch it out. And there are ways to even stretch that the patient can do this at home. That I don't need to even be there. I could teach them how to stretch properly, that they could do this without me being with them.
And also, during the break, you had mentioned something very important, and that is that a lot of women have surgery, slings or meshes, for some of these incontinence procedures.
Right.
And we're not going to talk about the surgery, but there may be a valuable role for pelvic physical therapy as well. Maybe you could say a few words about that.
Yes, I think that any patient that's having surgery where muscles can be affected, then they should learn proper strengthening afterwards. Especially now, people have knee surgery, hip surgery. Doctors wouldn't think about not having them have physical therapy afterwards. You have your shoulder fixed. Obviously, you need physical therapy to help stretch and strengthen the muscles afterwards. So the same thing with the pelvic floor. You're having an area fixed. You need to really fix the rest of it and kind of continue with that process.
That makes tremendous sense. We're running out of time, and we did talk in the intro a little bit about the new pelvic center at Norwalk Hospital. And maybe you could just say a few words about what is the pelvic center, who's there, who should come seek help.
So the pelvic center is a interdisciplinary team of OBGYNs, urologists, GI, doctors who are all there, along with physical therapy, so that if someone does have any of the issues that we have spoken about, in one center they can kind of get everything done.
So you've got all the specialists, the GYN specialist, gynecologic specialist, and the urologic specialist, the GI for the rectal area, and then you're part of this center yourself.
Yes, because if someone's having any injury, and if they are having surgery or not having surgery, they could still require physical therapy, and it's all kind of right there in one place that they can call up and say, I need physical therapy, and you have the doctors there with me so that we can work together to kind of get optimal care for the patient.
So the patients who should be considering this are patients with incontinence and pain, or pain with intercourse, or that kind of thing?
Yes. And anyone that has any of those issues, any bladder issue, any bowel issue, any pelvic pain, anything of the pelvic region.
How do they contact the center? Can they just call the general hospital number?
They can call the general hospital number, or they can call the outpatient physical therapy center, or they could even speak to their own doctor, and they could know how to refer them.
So this is an important area that people haven't discussed a lot, and it's really important that we begin to discuss this. We have about a minute left. Are there things, since incontinence is so common for women, are there things women should do, healthy women who are getting pregnant, just to strengthen their muscles, to reduce their chances of developing this?
Yes. I think anytime anyone experiences any leaking of urine, right away they should start really looking into how to strengthen that area, just like they would strengthen any other part of their body. And I always joke that people always say, "Oh, I have to go to the bathroom every 5 minutes," and that's the worst thing you can do for your bladder. You should not be constantly going to the bathroom. You should try to really train your own bladder and really strengthen those areas.
So this is a really important area. It sounds like you should seek help early, and advice early, and prevent bigger problems later. And we have a specialist here in town now. I know you're rare, because I know how hard it was to find you.
Yes.
We have a specialist here in town, and I'm so glad you were able to come on the show and help us and explore this very difficult area. We're going to keep you on the set because we want to have you. And here's this week's health question. Does being overweight increase bladder incontinence? Well, we have an expert on the set. Perfect question. How about the effect of weight on bladder incontinence?
I think weight does play a large role. I don't think it's the cause, but I think
So
it can.
just because you're fat, it doesn't mean you're going to have
Exactly, it doesn't mean you're going
incontinence.
to have incontinence. There are plenty of very thin people that have the same problem. I think it does contribute to the problem because any more pressure on that area is going to just cause more weakness.
And of course, we were talking about coughing, straining, laughing,
Exactly.
sneezing.
So if there's
being
more pressure when you're doing that, then that would just cause more leaking and incontinence.
So this is another reason to stay thin.
Yes, and just to exercise and really strengthen. You know, your abdominal wall really helps with your pelvic function. So the stronger your abdomen is and the less weight there is there, then the stronger your pelvic floor will be.
And that does bring me, I'm just going to extend this question a little bit because I asked it to you
Sure.
off air. Pregnant women, should they all be doing pelvic floor exercises?
Yes, I would say maybe not while they're actually pregnant, but after they have the baby, then you should definitely, and this is even speaking from my own personal
You
experience.
have 3 children,
I have
right?
three children, and yes, after you have a baby, that's when really you can kind of see where that weakness is. So the key is really to get everyone exercising right after they have babies, because that's when they're probably weakest.
Is
and
that
can really
advice
use the
routinely given to women? Are they the proper exercises?
I don't think so.
So how do they
From
get
the
that
experience.
information? I mean, there's only one of you.
Right. I think the more we get it out there and the more we say, look, if you kind of fix this early, if you don't wait till you're 65, if you kind of, after you have
65 isn't so old.
correct. But if you wait, if you don't wait, and you kind of have your children, and then you immediately start doing exercises, you know, that just prevents any issue from happening later. Not to say that when you're older you cannot fix this problem, because you can. Any muscle can be strengthened at any time. But if we could prevent issues, then
That's enormously helpful advice. So 2 pieces of advice here: stay thin. And the other one, though, is I think after you've had a baby,
Right,
that it's
really-
important to consider doing pelvic exercises. I wish we had more time because this is really all new information for me. If you at home have a question you'd like to ask on Health Talk, please contact us at healthtalk@norwalkhealth.org. I want to thank my wonderful guest today, Adina Leifer. I'll see you next week on Health Talk. Stay well and exercise our pelvises, I guess, huh? That's the message. Bye-bye.